Dr. Ejiro Emmanuel Akpo, who is currently unable to join, but he will be here shortly. Him too is seriously involved in this kind of also in critical care. When he comes on board, he will also tell us a little about himself. So thank you very much. We allow the presenter to start the presentation. Thank you. I've already introduced you, Ifoma Mama. Your slide, we were talking about it. Dr. Bello, please can you help us share the slide? Have you sent it to Dr. Bello? Ifoma, have you sent the slide to Dr. Bello?
Yes, I did. I have. But he said it will not be.
Okay, yes. Okay. Send your slide to me. Let me send it to.
Is it to Dr. Timmy Pray?
Preparing their springy.
Have you sent it? I've not received your slide.
Please, what's the name? I want to know who I'm supposed to send to. I've sent to Dr. Bella. I've sent to Dr. Giro. Hello?
Dr. Timmy.
Chime.
Dr. Timothy. Yes. I'm tracking you now.
Okay. Please, ma'am, have you seen it? Hello?
Yes, I am.
Hello? Have you seen it? Yeah, okay.
Yes, I've seen it.
Hello, should I just start?
Yes, please, you can start.
Okay. Good evening, everybody. I will thank God for another time like this to share some knowledge. I appreciate the person that introduced me, and I appreciate the opportunity, the privilege I was given to talk about this topic. I appreciate the encouragement I received. The topic is the relevance and roles of a critical care pharmacist in a critical care multidisciplinary team. So without much ado, I want to go on to the points I want to talk about. There is introduction. Other introduction, we understand a little bit what critical care medicine is, intensive care, what it means, critical illness, then multidisciplinary care, what it means and the benefits, then the team, the critical care multidisciplinary team itself. Then another point we are going to look at is the relevance. That's our focal, the focus of today's presentation, the relevance of critical care pharmacy services and specialty in our institutions, in our health institutions, and then the critical care pharmacist role, the roles of the critical care pharmacy specialist or knowledge manager or pharmacy consultant. And we'll try again to see how we can break down the roles in terms of scopes of activities, kind of graded scope of activities, because we know that even as we're talking about consultancy, specialization and all that, we still need, generalist pharmacists to work with the consultants. So we'll talk about their scopes, their roles in terms of scope. So the objectives I'm hoping to achieve is that we are going to understand multidisciplinary care and its benefits. Then why we need to involve the pharmacist and the consultant pharmacist in critical care team, why they are important. Then the roles of that of the pharmacist in that team. So we said that the critical care medicine is that medical specialty that focuses on the management and treatment and care of the critically ill. Is care of patients after major surgery or when there is need to observe patients a 24-hour of the day. We observe patients that we feel or we suspect that critical illness may occur. Also, it can also be seen as care of patients that have life-threatening medical conditions that require invasive care or life support. Then we say that critical illness in itself is that state that can arise from different medical pathologies. Example, we have myocardial infarction, what we know as heart attack, we have cerebrovascular accident, what we know as stroke. Then we have trauma, we have shock. Then it can also be something that can lead to impairment of vital organs. Vital organs are organs that a human being cannot do without, like the brain, the heart, the lungs, the kidneys. Without the proper functioning of such organs, we know that the human being cannot exist. It can also be impairment of vital functions that these vital organs do for us: consciousness, circulation, respiration, and so on and so forth, even excretion of waste products. So multidisciplinary care is an integrated team approach to healthcare in which medical and allied healthcare personnel consider all relevant treatment options and develop collaboratively an individual treatment plan for the patient. This integrated team, it means that there are multiple health professionals from several different disciplines that will communicate together to address different aspects of a patient's care or a patient's condition. Hello? 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 Please, have
Go ahead. We can hear you.
Okay.
We can hear you.
So, okay. So, benefits of multidisciplinary care. It will enable the treatment of an entire patient, the complete patient, treatment of the patient as a whole. That means there will be provision of a comprehensive care. Because there are different professionals, different experts focusing on a particular patient, it means that different aspects of that patient's health will be taken care of. The health providers will identify areas of needs, and different areas will be managed in an effective way because these are a conglomerate of professionals and experts in their different fields taking care of the critically ill patients. Another benefit is the fact that, in as much as skill sets should be a requirement for anybody that will be in the team being a part of the multidisciplinary care will also lead to sharpening of these diverse skill sets, like problem-solving skills, self-management, how to communicate with each other, how to carry out research. It is true that we need to have those different skills, different competencies in order to deliver services. But also being part of that team will improve, will sharpen our skills as much as we are using our skills. So we can say that multidisciplinary care team is an effective tool for facilitating collaboration, and it will improve care outcomes. So the people who can see in the team will have the intensivist physician, the surgeon. Then there is a group of people that really work hand in hand with the physician, because when you talk of the heart, many times the respiratory organs are involved. So we have the pulmonologist. We also have the anesthetist or the anesthesiologist, because these patients are patients that might be on life machine, might need the introduction of a catheter, and so there'll be the need of the specialist in anesthesia to be in the team as well. You have the intensivist nurse, then we have the clinical pharmacist or the consultant critical care pharmacist. You can have the physiotherapist, because these patients are they can be immobile for some time, so we need the physiotherapy and the physical therapist to help in maintaining movement. Also need a dietitian, because nutrition is in critical ill patients is a key subject. If someone's nutrition is poor, recovery prognosis for the person's condition can be poor. But when we have adequate nutrition, there is better hope for the person recovering. We also have the respiratory therapist that will help the muscles of the respiration to work, help the patient to exercise those muscles. We have the clinical psychologists, because we know that that kind of condition can be very discouraging. Then I learned something from a presentation we had with Dr. Pounds. I didn't know that students and interns or house officers and residents can also be said to be, part of a multidisciplinary team. So I added them as well. So the relevance of critical care pharmacy services, we know that why do we need to have critical care pharmacy services or pharmacy specialty or the specialists? Because of the critical state of a patient. And being in that state, we know that these patients will need complex medication regimens. There will be many and they will be complex. And the focus of pharmacists in care of patients will always be medication safety. As pharmacy practice has been advancing over the years, centuries and years, we say we moved from product to bringing all the way down to bringing a patient in the center of our practice. Yet, we still look at medication safety. It doesn't mean that our focus is on medication as a product per se, but it being safe for the patient. Because if the medication is supposed to do something and is not safe, we can achieve the person's cure and still incur some other problems. Now, in the critically ill patients, we have already said that the medications that the patients will have, there are so many and they'll be complex. That means there will be increase in risk, such as there will be drug interactions, there will be drug-disease interactions, there will even be drug nutrient interaction or fluid interaction, all kinds of interactions because of the complexity of the medication regimen. Another relevance we can see is that there is need for close monitoring of pharmacotherapy as a whole, so as to prevent drug therapy problems, so as to identify drug therapy problems, so as to resolve the ones that have actually happened. There is also need for adjustments. Maybe some drugs will be increased, their doses will be increased, some will be reduced, some will be eliminated, so as to ensure effectiveness of therapy, while at the same time avoiding adverse effects. And critical care pharmacy services, when it's involved in intensive care units, there will be reduction of morbidity and death. It also helps in the management of drug costs. It's actually a very essential component for providing quality care to critically ill patients. Now, the critical care pharmacist herself is one that has sound knowledge, skills, and competencies to focus on the pharmacotherapy components of patient management in the intensive care units. She is one that has very strong knowledge base of adverse drug reactions and adverse drug events. Such a person will be sound in pharmacology, therapeutic drug monitoring, pharmacoeconomics, pathophysiology, pharmacotherapy, therapeutics, and drug interactions. When we say strong knowledge base, even if there is so much to know, yeah. So even if one does not have everything in our head, we should have access to materials at our fingertips that we can reach out to at any time we want to make some references or consult or check up something. Even having access to fellow colleagues or other specialists in other areas is also part of our strong knowledge base. When you have access to the information you need, as I trained you. Like I said, the pharmacists should have diverse skill sets, like communication skills, how you communicate with the patient's caregiver, the patient himself, then other members of the healthcare team, of the critical care team. Then your subordinates, as a consultant, how you talk to other people, other pharmacists that are not specialists, so that you can achieve what you want. Such a person should have a problem-solving skills, should be able to reason in critical situations what to do, should be able to manage time. You know, the critical ill patient is someone that is between life and death most times. When somebody is at that stage, you know, the losing the person is very easy. So if a critical care pharmacist should be somebody that will have the skills that will enable her to make, you know, decisions, active decisions that can save, that can make the difference. It should be able to offer insights for management plans that will help the patient to, you know, do well and stabilize and be able to go on to maybe intermediate care units. So, talking about the roles of the critical care pharmacist, we have our usual medication order clarification, where we, you know, we ensure that the prescription indices, they are all there. We look at the prescription. We want to be sure that the drugs written, they are suitable for the patients. They will be efficacious. They will be accessible and they are affordable, and they will be safe. Because when these elements of rational drug use is not there, it makes a mess of the care. So we have talked about you know, identifying potential and actual drug therapy problems, preventing potential and resolving DTPs. This is one of the roles of the critical care pharmacist. Then adverse drug reaction management and drug interaction management. If two drugs are going to interact, we should be able to offer alternative or offer suggestions, maybe spacing. Then we should also be able to recommend alternative therapies or therapies that can, you know, help to minimize costs. Then the another role is that the critical care pharmacist should be able to, you know, provide the nutrition support, because nutrition is very key for the patient. It should be able to participate in patient ward round so as to contribute her knowledge to the care of the patient. The critical care pharmacist should know how to offer basic life support and cardiopulmonary resuscitation. Should also know how to, you know, what to do when the advanced cardiac life support is needed. It should be such that will be interested in clinical research. You know, it should be a lifelong learner. So when we look at, in terms of scope of activities, we say that these different roles that are not even exhaustive. We have the fundamental level, we have the desirable level, we have the optimal level. The fundamental activities are more of those services that are associated with, order entry, distribution, these are, they are necessary for provision of medications that we are going to use as part of the tools for the pharmaceutical care. So it involves, procuring of medications and nutrition. It also involves evaluating drug therapy, the prescription, to be sure that indications are taken care of and there are no untreated indications there or unnecessary drug. We should also be able to take care of drug allergies, drug interaction. So there are those basic, fundamental, foundational services that a clinical pharmacist should render. A part of fundamental services too, the pharmacist should be able to provide drug information to other members of the ICU team. Then when you talk about the desirable activities, it's like stepping up to more competent level. The desirable activities, they still include, fundamental activities. Then in addition, some critical care specific pharmacotherapeutic concerns. There is provision of more specialized patient-focused functions, like, therapeutic drug monitoring. At this stage, it's more of a critical care pharmacy specialist. He or she will be involved in multidisciplinary rounds, medication history taking. So we'll say that at this stage, the critical care pharmacist is able to review the patient's drug history to determine which maintenance drug should be continued during the acute illness. It should be able to clarify effective dosage regimen. The critical care pharmacist will work with the clinical dietitian to provide the nutrition consultation, know the kind of drugs that will be compatible with this type of nutrition. When the nurse wants to, give certain drugs, it should be able to offer sound clinical judgments about those drugs, whether they are sources that can be mixed with the nutrient the patient is taking. Also, a pharmacist should be able to, provide lectures for students. So when you look at, when we come to this stage, we see that the fundamental activities more like clinical, more of clinical than logistics. So the pharmacist is more of a clinician. But when we get to desirable activities, we see that in addition to the clinical responsibilities, the pharmacist is also an educator. Is involved in training pharmacy students, residents, fellows. Is also an educator. Let's move on to optimal activities. Now, optimal activities is the peak. Is at the peak. Here, the pharmacist is an expert. Is an expert. The range of activities will still involve, will cover fundamental, desirable services and more. The pharmacists at this stage, reflects a more advanced practice model where the pharmacist is fully integrated into the multidisciplinary team. The pharmacist is completely dedicated to critical care, or intensive care units. He has specialized roles in research and education and is involved in specific functions that will maximize the patient's health outcomes. The dedicated critical care pharmacists will join physicians in discussions with patients and their family members to make decisions about their treatment. He also takes part in educational sessions that involve the other medical staff members, students, residents, be them doctors or pharmacists. The pharmacists can also be part of, can also teach, not only be able to offer advanced cardiac life support, can also teach cardiac life support, advanced cardiac life support, pediatric advanced cardiac life support, also develop residencies and fellowships in critical care pharmacy practice. At the level of optimal activities, the pharmacist can design pharmacy programs and services. When we look at this stage, we see that the pharmacist, the critical care pharmacy consultant, here is not just a clinician, is not just an educator, is also a researcher. Is a researcher, is an academician, is also an administrator, is a peak of, the roles in critical care pharmacy. So it's something that will require everyday learning, everyday training, everyday practice. That's why it would be good to incorporate, critical care pharmacy services in intensive care units, because it's only by practice that the critical care pharmacy specialists or consultants can, improve and be the best of herself. It's only in everyday practice that the person will be able to, offer services up in an optimal level. So, like I said here, the pharmacist can publish in the pharmacy journals and secure funds for conducting research. He's a researcher in addition to being, a clinician and so on and so forth. So in conclusion, I want to say that pharmacy services in the critical care unit, for it to be efficient at all, even at its very, basics, which is as simple as ensuring availability of medications to patients. It also has to expand to more patient-specific optimal models where the dedicated pharmacist can evaluate drug needs, be part of the design and achievement of complex drug regimens in areas where we have very high patients, patient care, patient attention, where the patient has to be watched 24 round the clock. And these recommendations, is what, individual pharmacists and the pharmacy departments can, develop and see how they can maximize their services. Because the impact of involving pharmacists in critical care setting cannot be overemphasized. You know that the pharmacist in all different types of care, is very important. How much more they care of the critically ill. So when pharmacists assume responsibility for, for medicine therapy as part of as part of integral part of multidisciplinary healthcare team, will have reductions in adverse drug reactions, events. There will also be reduced costs. There will be reduced prescribing errors, dispensing errors, medication errors. There will be improved clinical outcomes for the patients. There will also be, financial benefits for the specialist practitioner herself. So I just have my references, and though I've ended my lecture, I just wanted to say that certain things I feel that the critical care pharmacy focus areas are, I just listed these as, some of the focus areas that one can study on in order to, build up knowledge. Can also form part of what you can, use as our future clinical meetings, future Zoom presentation. Then also deemed it, necessary to also list out medicines that are used in the care of the critically ill patients, hoping that maybe we'll be able to start doing a monthly medication review so that we can be looking at some of these drugs. So that brings me to the end of my lecture. Thank you very much for listening. I'm through. Thank you very much for listening.
Who is the moderator?
I want to thank you so much for this wonderful presentation, Pharmacist Mama. I was thinking Dr. Ejiro is here so he can continue his moderation. So, Dr. Ejiro, please can you unmute yourself and then go ahead to moderate? Thank you.
Thank you very much, Dr. Timi, for hanging on for me. I'm very sorry for not being part of the meeting from the beginning. An emergency to sort out. Just rounded up. So thank you very much, presenter, Pharmacist former Iberi, for a wonderful presentation. So at this point, can we have questions and comments for the presenter? We have questions and comments. Dr. Timi, I think your hand is up.
Thank you very much, Dr. Ejiro. Mine is not a question. I saw Professor Wanade as one of our participants, so I just wanted to recognize him and really appreciate him for, always being here. So thank you for being here. And, normally as you come on board, we will always want you to, make a comment, one or two, because you are actually coming from the college. So we will really like to hear from you, sir. And I also want to recognize our wonderful Dr. Maureen Uwafo, who is our certified critical care specialist on the platform. She's also here. So these are the persons that we say, they must at least say something on this presentation. So thank you so much. So I want to call on the professor to please say a few words. Thank you, sir.
Okay, thank you very much. I appreciate you greatly. I sincerely appreciate the presenter too. Each time there's a presentation on CPAN, especially critical care, I'm very, very much interested. So this is not different. I am actually here to learn, to listen to the presenters and then get one or two new information. And I must tell you one thing, no matter how far you have read, no matter how wide you are exposed, once there's a presentation from any quarter, if you are careful to listen to it from the beginning to the end, believe me, you learn something new. You learn so many things. That is one thing that we are not gifted in pharmacy. We hardly develop interest in learning. We hardly develop interest in listening to what people are presenting. And I will tell you, I have gained enormously by mere participation in CPAN presentations. Whether the presenter is an intern pharmacist, a youth corper, or an undergraduate, believe me, I learn every day. I learn from each thing that the presenter said. Today, I've learned quite a lot. I appreciate the presenter. I appreciate you for recognizing me. And because I'm coming from WPCP, no, I'm here as an individual. I came here as an N19 to learn and listen. But if you want me to convey the message of how you are doing well in critical care, oh, sure, I'll do that. I want to also appreciate Maureen. She has been very, very helpful. We have a residency program for critical care. Maureen, AFAM, and Moise from Lagos. They did that and submitted to me this week. We are going to work on it and then polish it again to make it a document of the college. All these residency programs that we are organizing for the 6 existing faculties, five existing specialties, we are going to work on it and then present at the AGM coming up next week. So my summary is thank you so much. I am truly honored. I have learned. Keep it up. Keep the flag flying. I'm so proud of the presenters, proud of the organizers, proud of Susan, and indeed proud of the development we're having in pharmacy in Nigeria. Thank you so much.
Thank you very much, Prof, for that wonderful comment. We now want to call on Dr. Maureen Uwafo. Yeah, hand is up.
Good evening, everybody. I hope I'm audible. Right now, I'm inside the village at Anambra State. So, and there is poor network here. Sorry, can you hear me?
Yes, you're audible.
Okay, I want to appreciate our dear Professor Wanang for finding out time to be with us this evening. So we're very grateful. Okay, I want to start by appreciating the presenter. I'm so glad that now I can probably say that we are now starting to have a critical pharmacist here in Nigeria. Kudos to you, my dear. Okay, why am I here in Anambra State? I left Enugu last week to help out as a clinical pharmacist, as a critical care pharmacist at the newly opened hospital. If you go to your Google or tomorrow at the newspapers, televisions, you will hear about new hospital that was opened today at Orifite. The name is Team Irene Oposa Memorial Hospital. The hospital was built by Sir Emeka Okos, a philanthropist. He built a world-class hospital inside his village at Anambra. And his powerful foundation from America came down with a team of professionals to do open heart surgeries. They didn't come with any pharmacists. So I was called upon from UNTH to really help out because it's a new hospital and they employed just 2 newly employed pharmacists, so naive. So when I came in there last week, I started by procuring their drugs. They got nothing. They didn't even know what medication should be there for them to manage their patients after the surgery at the ICU. So we did a lot of procurement, emergency procurement, and we took it off from there. So right now we've done up to 8 open heart surgeries. We had up to 3 mitral valve replacement, ASD, VSD, and go. Why am I saying all this? Is what the role of critical care pharmacists was highly needed in such an environment, and I think that we pharmacy did not disappoint the team at all. So we're up and doing, even during this clinical meeting, I use my earpiece one to listen while we're doing a ward round, because I must have to contribute. So we just finished the ward and I came out to, to con again. So we made a lot of impact here, and I tell you, all the health professionals here, both the Americans know that there is something called they know, and they felt our impact. The most important thing here is that they're about to go tomorrow. That the Americans are going back tomorrow. So early this morning, they called main team of those patients that were operated to represent the farmers. So they asked me, what are you going to do as to manage these patients? Once we make sure that to make the drugs available as they needed, and we still the drugs. And the most important thing, we're going to manage these patients anti-coagulation. They were so depressed, So it's our role as a pharmacist to manage patients anti-coagulation. People that had a mitral valve replacement, they're going to be warfarin throughout their lifetime. And what is highly narrow stroke. So I brought up warfarin education booklet. So to educate these patients, so naive. So they really felt the impact of critical care pharmacists in the team. So I want to say that we pharmacists in Nigeria, we are coming up and our specialty by the grace of God. In 3 years' time, we have so many critical care pharmacists to help us in our practice here in Nigeria. The 2 pharmacists they employed, they didn't know about critical care at all. I was trying to take them to runs inside the ICU. And I'm still trying to at least bring them up a little bit. So why I'm saying that there's need, urgent need for us pharmacists to really know more about critical care so that we're able to help our patients and also represent our profession. So they're calling the surgeons, the intensive, they're calling the pharmacists. And we told them what we can do to help these patients. So I pray that God help us. And I want to thank WSCC for them to help us to bring all these specialties on board. Thank you, especially Professor Wanang. And by the grace of God, in 3 years' time, we'll have so many satisfied critical care pharmacists that will help us keep our patients. Thank you very much.
Thank you very much, Dr. Maureen Wanfo, for your contributions. Do we have more comments or questions for the presenter?
I think there's a question on the chat.
Okay, let's see. Okay, there is a question there from Obianuju. It says most patients in ICU usually come down with hypotension. Why? Can the presenter please take on that? Why do most patients in the ICU come down with hypotension? Is our presenter still with us?
Two.
Thomas's mama. Thomas's mama, are you still with us? Okay, we can't seem to get hold of our presenter any longer. Dr. Maureen Waffle, can you throw a little light on the question?
Please, can you repeat the question, please? Sorry, can you repeat the question, please? Hello.
The question says, why do a lot of the ICU patients come down with hypotension? Why?
Okay, let me start by saying that we call it critical care ill patients. So the critically ill one. So two, there are so many things that may arise to a patient having hypertension in ICU. One, there is low cardiac output, they're bound to be hypertension. We all know the formula for BP. So there is low volume. So in most cases, if there is bleeding, if there is sepsis or infection, if our patients are highly dehydrated, so but most importantly, low cardiac output. That was why anytime you see our patient coming down with hypertension, we start by resuscitating with a crystalloid, like normal saline. So we push crystalloid, most of the time the BP come off. But once you continue to push and there's no increase, then we move on to use of inotropes to help to increase the cardiac output, heart contractility, and the rest. And this will help the patient to BP to come up. When we must have, eliminate other factors like infection and low volume. So it depends on the case scenario. So once you eliminate the factors and infuse more volume like crystalloid, if that one failed, then you move up to use of inotropes. That's what I can say. But it's good to have a good picture of the patient. From that, you can now bring up other factors that might arise and how to manage such. Thank you.
Thank you very much for that, the answer to that question. Do we have our presenter back? Pharmacist Mama. Okay. Do we have other comments or questions?
Hello. Hello. Oh, wow.
Hello, we can hear you now. Welcome back.
1 second.
Can you hear me?
Kind of sense. Hello, yes. Hello.
Yeah, we can hear you now.
Okay.
There was a question in the chat box that has been.
Let me see.
Did you hear Dr. Maureen's reply to the question? Answer to the question.
Which question, please? Which question? Okay. Most patients in ICU usually come down with hypertension. Okay, most patients in ICU usually come down with hypertension. Why?
Dr. Maureen answered the question. I'm asking if you heard what Dr. Maureen said.
No, when? Okay, anyway, what I can say is that I would have thought that, agitation will even lead, anxiety will lead more to hypertension. But, looking at hypertension, there'll be the issue of bleeding. There'll be loss of blood. That's loss of volume, loss of blood volume. That can also cause hypertension. Then maybe the medications too, the type of the effect of the medications on the person's cardiovascular system can also cause hypertension depending on the medication, because I know that many of them, they can require negative inotropes depending on their situation, as what I can offer.
Thank you very much. You're not far from what Dr. Morin also mentioned, being
What did she say?
patient specific, being the condition being patient specific, and cardiac output being low.
Cardiac output. Okay. Okay.
So it's in line with what Dr. Morin just also answered. Thank you very much. Do we have more comments or questions? Okay, I'll just quickly want to thank the presenter once again. Thank all those who've been part of this call.
Hello. What's happening? Hello. Am I in?
Hello.
Am I? Okay. Hello. You were saying something,
Yes,
sir.
I can hear you.
Yes,
I'm
sir.
appreciating your presentation. I'm thanking you for a wonderful presentation. I'm thanking everybody who have been part of this call. And I'm particularly happy with the fact that there is so much in it. It's a good trend, and the college have done so much to ensure specialization in critical care. And with pillars like Dr. Mori, critical care is working stronger. I want to specifically stress that every pharmacist who find themselves in the ICU need not be scared, need not get worried about what to do. Whatever happens in the ICU, it's basically not different from whatever happens in the other wards. Once we put our mind to it, like the presenter already listed what we should be doing in the ICU, it is doable. Dr. Morin have given us so much insight into what critical care is, and not just giving us insight, her practice have become, will I say, globally known. And we can see that because of her work in UNTH, she's found herself in Anambra State currently. Now, why am I saying that any pharmacist who find himself in the ICU can actually make the clinical pharmacist impact felt? Like Dr. Morin is following up with the open heart surgeries. There is also the pediatric open heart surgery by another NGO, Hospital for Humanities, that is going around in the country. They were once in Akwa Ibom State, and about 7 pharmacists were there. And indeed, the impact of the pharmacists was felt. And Hospital for Humanities is setting up their own facility in Abuja. And from the 21st to the 23rd of this month, there will be another open heart surgery, pediatric open heart surgery. Pharmacists who were part of that first team were also called upon. And these are pharmacists.
Hello, am I in?
Yes, you are very much in. We are hearing you. We are on the call. So we're only encouraging pharmacists to remain passionate. And college have already set the ball rolling for specialization in critical care. CPAN is working seriously to make this continuous learning possible through these clinical meetings. So we want to encourage us to continue to be part of these calls when they come up. And we look forward to, in further presentations, see presentations giving us actual practice, case reports, so that the rest of us can be learning from these case reports. And so the hands-on benefit can then be felt by all. So if we do not have further questions or comments, can we have a volunteer to close the meeting for us? Dr. Simi.
Yeah, I can hear you. Can we call on pharmacist Zuwaira Maruf? Ma, please, can you please give us the closing remarks? I know you are in the education committee. So give us the closing remarks and also run it up with a prayer. Are you there?
Looks like many persons are already going up.
No, she's there. On mute. She's there.
Hello, good evening, everyone.
Okay. Oh,
Hello.
good evening. From you. Good evening.
Hello.
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 Good evening, ma. You can go ahead. Yeah, you can go ahead. Just round up.
I heard it was breaking, so I didn't hear what you said completely. You said something about a remark.
The closing prayer and then the remark. Yeah. Yeah.
Hello.
I'm hearing you, ma. You can do the closing remarks and prayer.
Okay, I heard
can you
prayer.
Hear me now?
Remark.
Okay,
remark.
Yeah. And prayer.
Is that? Oh my God. Okay. So you're breaking. So I'm assuming you said remark on prayer. So thank you very much to the presenter. Very wonderful presentation. I think we're making a lot of headway, and it's very important that you have highlighted the different areas.
Yeah.
Hello.
Yeah. So just round up, ma. Thank you.
So my network is poor. I'm sorry, I can't hear you completely.
Okay.
So we thank God for this meeting, and we hope that we'll have many more successful meetings and presentations as we go along. Thank you very much, everyone, and have a good night.
Yeah. All right. Good night, everyone. Good night.
I don't know if you have heard that. If you have,
yes,
we have. I'm sorry. Yeah.
We heard you. We heard you very well. Thank you. All right. Good night. Good night, everyone. Good night.